Napapanahon na nga ba para ibaba ang alert levels sa Kamaynilaan? Kausapin natin ngayon si infectious disease expert Dr. Ron Jean Salante. Magandang gabi po sa inyo, Dr. Salante. Let's begin with this po. Kayo po as a doctor, you were one of the first to get the vaccine in March. Is that right, Dr. Salante? At ang nakuha po ninyo is
Yeah.
Sinovac.
Yes, Pia, correct.
And that will mean, Dr. Salante, tulad nga ng sinasabi ng DOH, that you should be having a third shot around this time. And if so, are you confident that you're going to get it very soon? Because after all, we have ang daming dumarating, no? Libo-libong bakuna ang dumarating almost every day.
Well, we're hoping that the Department of Health can implement the giving of the third dose to healthcare workers anytime soon, and hopefully that will come in time.
But it's already mid-October, Dr. Salante, and I'm sure hindi lang naman po kayo ang nag-iisip noon. There's so many healthcare workers, so many doctors, nurses who are thinking the same thing. How are you coping? Because you are, of course, literally on the front lines. And what are you doing to keep yourself safe?
Yeah, so thank you for that, no. And sa ngayon, no, medyo nabahala kami dahil marami-rami na rin yung nakikita naming breakthrough infections, no, since March, since September and early part of August, no. And we're really strengthening our health protocol. When we face our patients in the ward, in the isolation room, we really have to be strictly implementing our health protocols. And at the same time, when we go home, always do the important and appropriate health protocols. That's the only way we can protect an added layer of protection, despite the waning protection that is being seen now with this vaccinated in March.
Dr. Salante, like I said a while ago, ang daming dumarating, no? Thousands of doses, vaccine doses are arriving in the Philippines almost every day or every other day. And, what we've been told is that there's some, like kanina, no, nung 6 p.m. newscast ko, nakausap ko ang Cagayan Valley Region, Regional DOH. Ang issue is geographical challenges when it comes to delivering vaccines to LGUs. But what are the other problems, Dr. Salante? Because Charlie Galvez is saying, wala na po tayong problema sa supply. We have many thousands of doses coming in, like we said. It's really just sending them out to the LGUs and making sure that people get these vaccines. So apart from those challenges, ano pa po ba ang problema natin? Ano pa po ba ang challenges natin in the countrysides, in the provinces, in towns outside Metro Manila?
Yes, no. Aside from the logistics, no, I think ang isa dapat tingnan dito ng government natin ngayon yun pa ring vaccine hesitancy, no. Alam natin there are reports na sa ibang provinces, especially for those provinces na medyo konti lang naman yung masyadong hindi ganun kataas ang kaso. So there are people, especially the vulnerable population, are still not wanting to get vaccinated and are still waiting for, I don't know what's the reason. But I think titingnan din siguro natin yung element of the vaccine hesitancy among this vulnerable population.
Okay. Can we talk about this new pinag-usapan ng WHO, this new sublineage of the Delta variant? Because, and we all remember this, Dr. Salante, no? Grabe ang anxiety levels natin lahat, no? They went through the roof. These anxiety levels went through the roof because of this Delta variant-driven surge for August and September. And then now, there's news about this new sublineage. So, tapos, hindi pa sure eh. Is it going to be not mas nakakahawa ba? Will it be, even more challenging? What should we think about this right now?
I think we should still and not be complacent with our health protocols, no? Even if we'll downgrade the alert level, the prospect of these new variants coming in fact, this new variant, the subtype A4, is detected in a country where there is already a higher rate of vaccination. So there's a possibility that it will still be possible that we can have this variant, and that can also again cause more surge of cases. So important here is really the health protocol. The vaccination rate should be ramped up, and of course, each one of us should always be following the health protocol.
Very important, Doc Solante, what you just said. No? Even if we downgrade the alert level, what you're saying is we should not downgrade our vigilance either. Lalo na po ngayon kasi October. So syempre, pag September, October, ang nasa utak na ng mga Pinoy, Pasko. So eto na naman tayo. I remember before last Christmas, no, we were told, no, we're not going to have a regular Pinoy Christmas. What about this December? Malabo pa po ba ang family reunion, halimbawa? Malabo po ba ang mag-get together, diba, nasanay po tayo sa mga Christmas party. So that's not going to happen yet, Dr. Sanante?
For the family reunion, I think there should be some guidelines on that, no? And only fully vaccinated can attend, and there should be limitations also of the vulnerable population. We can do that, but we have to be conscious about who should be in that gatherings. And I really discourage the vulnerable population, the 60 years old and above, the immunocompromised, to be in this type of gatherings. Medyo malabo pa dahil mababa pa ang vaccination rate, especially outside of the National Capital Region.
All right. And even if, like you said, although you do discourage it, even if there are reunions like that, ang mahirap po kasi, Doctor, syempre mga Pinoy families, alam nga namang hindi magbebeso-beso, hindi magyakapan. So, wag na lang, parang ganon. Just to be really safe.
Yes, yes. That's, especially the vulnerable population, Pia, no? Itong mga matatanda. Kasi these are the people now that we're seeing a lot in the hospitals.
Okay, and my final question, Dr. Salante. So we're seeing the numbers go down, 3,000, 4,000. Yun na po ba talaga yung real, do the numbers reflect the real situation on the ground? And because of that, can we breathe a little bit easier now?
Yeah, I think so. No, this is the real number now because the trend has been consistent for the past 2 weeks now. It's downtrending, and hopefully by November or December, we can see a better picture of how low the cases are. And but you still have to be compliant with the health protocol.
Vigilance pa rin. Maraming salamat po sa inyo, infectious disease expert Dr. Gene Solante. Thank you so much for joining us tonight, sir.